This summer feels so different than last summer, but we're not out of the pandemic yet, and so many people are still hesitant to get vaccinated. But I will say here in Oakland County, we are pretty close to reaching that 70% threshold that has been mentioned. It's great to bring in Dr. Russell Faust with us now here on the MegaCast. He's the medical director for the Oakland County Health Division. And Dr. Faust, can I ask you, why do you think Oakland County has such a higher vaccination rate than some of our neighboring counties?
Oh my gosh, I wish I had the answer to that, because then I could get everybody else vaccinated, right?
But it's, I know that we're doing the lottery right now. There have been so many incentives along the way, including Oakland County giving the $50 gift cards. There was free beer, free donuts. But yet there are some people out there, it seems they're just not going to get vaccinated. Do you think we need to go the route of France and require this vaccination?
Yeah, I heard John Lippert say that in your last chat. And by the way, that was very interesting. It's funny. My family happens to be at Grand Valley right now, checking it out for my daughter for colleges. But
no way! Look at that. We should have hooked you up with a tour.
Yeah, I don't know whether we need to go that far. I will say this: we have a couple colleges here in county, Oakland University and Lawrence Tech, I think, are both, as they are residential colleges, that is, they have dormitories on campus, are now requiring full vaccination to be on campus in the dorms. I think that's probably reasonable, primarily because those congregate living facilities they're very vulnerable. Once these variants get in there, it's like wildfire. It just goes through the students. So I think that approach is pretty reasonable. I feel it. I want to make two comments about the 70%. Yes, we're fortunate to be at 69.4% as of yesterday, based on the data that we have. And we're fortunate in that we have it here at the Health Division. We have the resources to get the vaccine out there. We're a hub distributing to our partners in the community. We have some great, very energetic partners in the community, some practices that are getting it out there. And we've had some good campaigns here. I do miss the days of vaccinating 4,000 or 5,000 at, Novi Showplace. Because there's been less demand, we're going out into the neighborhoods now, and we're at, faith-based facilities, churches and what have you. We're at the job fairs, we're at art fairs, we're at smaller venues and doing everything we possibly can, because this is how we won the pandemic. Every arm counts. That is, we need to get it into every arm that we possibly can. And I don't know exactly what the hesitancy is. That is, why are they resistant? When I look at the data, I know that the greatest infection rate and the lowest vaccination rate is in that 20-something, 19 to 29 range that are, the immortals. Nothing can harm them from their perspective. And so they just don't bother. And I'm here to say that plenty of those people get severely ill when they're not vaccinated. CDC tells us right now that 99% of the people that are ending up infected right now are unvaccinated. And we know that every single infection, every active infection, is a factory for producing variants. So we need to get more people vaccinated, because those variants are, Delta variant, for example. Every variant that establishes a foothold is more readily transmitted. Delta variant is more readily transmitted than the UK variant, B117. It is now the dominant variant in the United States. 58% of infections are now Delta. We know Delta's here in Michigan. We know Kappa is here in Michigan. We need to get everybody vaccinated.
How concerned are you as a medical professional thinking about, like, we have Faster Horses, the huge outdoor concert coming up, this weekend, and you just think about all of those people standing shoulder to shoulder, and some will be vaccinated, others will not be vaccinated, and we know that some people that are not vaccinated will not follow the recommendations of wearing a mask, and yet we have this variant out there. Does that concern you?
You bet. But again, we're very fortunate here in Oakland County to have essentially 70% vaccinated. I've got a couple frustrations. One is that number is kind of artificial.
Yeah.
That number 70%, and I have no problem with the governor saying that that's our goal, or the president saying that's our goal. But understand that number was based on mathematical modeling that occurred a year ago at Johns Hopkins, okay? Every variant is a little bit more readily transmitted. And so with luck, we'll exceed 70% vaccine in our community because those mathematical models change for every single variant. So it's a little bit artificial to point to 70% and say, that's our goal, we'll be safe at 70%. It depends on what variant is dominant. And so it would need to be remodeled, recalculated, and it becomes incredibly complex when you've got 100 variants.
I hear
yes.
some people, when you're talking about that 19 to 25, I hear some people in that age range who say, well, I've already had COVID, so why do I need to get the vaccine?
Yeah, great question. Everybody needs to get vaccinated, whether they've had COVID infection or not, because the so-called natural immunity from being COVID-19 infected doesn't last very long. We know for a fact that on average, it goes along and drops off between 3 and 5 months. Some sooner, some later, it's all on an individual basis. But what we know now is that the immune response to the vaccine is, one, much stronger than from natural immunity from being infected. Number two, lasts much longer. So, everybody needs to get vaccinated. And, I want to say that that crowd really should be getting vaccinated not only for their health and safety, but for, the folks that they love, for their friends and family who might not be in the 20-something range, but, their grandparents, for example, or their parents who are older.
So do you think, I know the studies are still ongoing for children younger than the age of 12 to get vaccinated, but how important will it be to get a vaccine for that younger age group to help us emerge from this pandemic?
Yeah, I think it's on the way. It's a lot less important than for the adults, okay? The data tells us right now that those younger kids are less severely infected than the older teenagers or adults, and they're less likely to spread the disease to others. Yes, it would be good to get them vaccinated just to prevent the spread. And the fact is, it's a vaccine preventable disease. And the fact is, we still have young children die from COVID infection. 2 months ago, we had 10 kids over a month period on ECMO down at Children's Hospital. ECMO is an absolutely last-ditch effort to keep somebody alive. It's the heart-lung bypass machine. Somebody my age, they probably wouldn't even bother with, and it's all they're doing to keep these kids alive. Everybody has it in their head that children are not affected by COVID-19. And in general, they're less at risk for severe outcomes and death than if they get infected with influenza. So yeah, they should be getting the flu shot, but they should absolutely be getting a COVID vaccine when it becomes available. Any vaccine preventable death that occurs is an absolute tragedy, more so in a child.
Dr. Russell Faust with us here on the MegaCast. He's the medical director for the Oakland County Health Division. And Doctor, I know that some of our healthcare facilities, Henry Ford being one of them, they have announced mandated all of their employees to be vaccinated. And do you think, though, maybe we emerged or lifted some of these restrictions a little bit too soon? Because when you look at the people that are unvaccinated right now, what's the incentive for them to do it other than, well, they should be doing it for the health of the community, but if they've already decided not to do it, and there's, no reward at the end, which that's how our society kind of works, you don't have to have a mask on, you don't have to do this, that, and the other. So is there, did we lift them too soon because there's no reward for the people to be able to get a vaccine?
I can't really speak to how appropriate it was to lift, the restrictions. I can just emphasize that everybody needs to be vaccinated. And you're right, that no matter what you have with regard to incentives or, say, punitive measures, there are going to be a number of people out there that are just getting their scientific and medical and clinical facts off of social media. And that's just not the place to be getting, your information. I do want to emphasize, I don't know how much time we have, but I do want to emphasize before we end that the place to start is cdc.gov. We need to go to a vetted, trustworthy, reliable source of information, not Facebook or Twitter or any other social media site, not even the web in general. Much of that information is simply clickbait. It's there to get you to click through, it's sensationalized, and it's misinformation. At least 50% is misinformation. I take calls every day from physicians and parents who are citing or quoting facts that simply are not. And so we really need to start with, trustworthy information. And I think, with that, I think people will see the reasonable, rational, goal of getting vaccinated.
It's concerning, too, how many vaccines that we have here in the U.S., including the state of Michigan, that are about to spoil and go bad, yet we have other countries that desperately need this vaccine.
Yeah, it's disappointing. It is disappointing. We need, everybody just needs to get in and get vaccinated. We're available. I think everybody who is vaccinated should really talk to their friends and family, get a sense of what the resistance points are, like where are they hung up, and provide facts, provide a cdc.gov website to go to and answer those concerns, address those concerns. And in Oakland County, we have plenty of options, plenty of venues to go out and get vaccinated. Certainly Oakland County Health is at 10 or 12 sites. As I said, we're at job fairs and art fairs, etc. We're at North Clinic at 1200 Telegraph. We're at South Clinic down in Southfield at Garfield. And, you can go to Oakland County Vaccine.com, make an appointment, or find a site and simply get walk-in times and just show up and get vaccinated.
So if someone does decide to take advantage of one of the clinics, or like you said, if you're at the art fairs and you're out in the public, do they get a choice of which vaccine that they get to take, or is it pretty much whichever one you have on hand that day? It's
what we have. It's what we have. And I think, we're fortunate here in Oakland is that we have access to the mRNA vaccines. We have access to Pfizer and Moderna that require a little bit more care, logistical care with regard to handling, freezing, and management overall. But whatever they can get, every arm matters. We need to stab every arm we possibly can and get vaccine into it.
Dr. Faust with us here on the MegaCast. Just a minute or so here left with you on the show. Is it okay for people, if they got the Pfizer one, to get that second shot, the Moderna one? I know other countries are allowing for the mixing of the vaccines.
Yep. So right now in the U.S., CDC advises that you stick with the series that you started with. That is, if you started with Pfizer, started with Moderna, go ahead and get the second shot with that. Under certain circumstances, CDC says that they are interchangeable. It is allowed to get your second shot with the other. And I think that's perfectly reasonable. They're virtually identical in terms of the setup of the mRNA vaccine. So they end up both producing spike protein. So it's a pretty similar product.
Dr. Russell Faust with us here on the MegaCast. He's the medical director for the Oakland County Health Division. Dr. Faust, we always appreciate your expertise and also sharing your information with us and our listeners and viewers throughout this entire pandemic. Thank you so much for your time.
Thank you for the information, and thank you for the invitation.